Good afternoon, Professor Berkeley. This will be my lesson 13 assignment in video format. For this assignment, I interviewed a registered nurse at the Northwest Hospital Outpatient Surgery Center located in Oro Valley, which is a new area, new suburb of Tucson. Therefore, the two categories of healthcare workers I used for the assignment were nurses and administrative staff at the surgery center. I conducted some research through the National Institute for Occupational Safety and Health, NIOSH, that defined workplace violence as violent acts, both in the form of physical assaults and threats of assaults directed towards personnel at work or on duty. Additionally, I conducted some research, since I'm talking about healthcare workers, through the Bureau of Labor Statistics, and where they reported that healthcare workers had more than twice the incidence of injuries with days away from work resulting from violence compared to the overall workforce. Lesson 13 of our course defined workplace violence and provided 4 discrete types of incidents that fall under workplace violence. One of them are criminal incidents, typically like a robbery. 2 is a customer-client incident, similar as a nurse providing care to a patient. 3 is a co-worker incident, often bubble up based on various conflicts that eventually boil into violence. Lastly, it's domestic violence incidents that somehow find their way into the workplace. Based on the interview, I've summarized the risk factors facing the registered nurses and the administrative support staff at the outpatient surgery center. The staff do not work in a high crime area. Oro Valley is a recent new neighborhood of Tucson, which is relatively safe. There's no exchange of money for the services, as typically services are billed to clients' individual insurance companies. There's no delivery of passengers, goods, or services. The outpatient surgery center is a fixed location and therefore not a mobile workplace. Staff do have contact with the public, both in the form of patients and the visitors. The staff do work occasionally with unstable, volatile, violent individuals in the form of prisoners that are brought in for surgeries. However, that risk factor is somewhat minimized since they're always accompanied with a correction officer. The staff do not work alone, but they do work in small numbers, both during the early opening hours and the evening closing. The staff do not guard valuable property or work in a community-based setting. There are no security guards at the surgery center. Only security guards are at the main hospital, which is actually a good distance away from the surgery center. There are no closed-circuit TV cameras for the surgery center, for the reception area, lobby, exterior, or parking lot. And since there's no security guards, there are no patrols of the premises to ensure doors are locked, keypads functioning, parking lot secure. Of particular note was there's a keypad lock used for gaining access to both the administrative wing and the operating room. However, there's one code used by everyone that is typically not changed even after a member of the staff's been terminated. Lastly, one risk factor is living in the state of Arizona, being a constitutional carry state where anyone can carry a concealed weapon. In this case, any particular patient could potentially have a concealed weapon on them in the form of firearm or knife, even though there are posted signs both on the exterior and interior of the building. The surgery center does have a violence prevention program. It's a written program that is briefed annually. Additionally, annually, employees are required to take a computer-based training on workplace violence. The training does have specific scenarios with question and answers built in. Additionally, annually, employees are subjected to surveys. However, the surveys are more geared towards general job satisfaction and views on supervision and management, and no questions are asked on workplace violence prevention programs, risk assessment, security assessment, and so forth. They were not sure if any worksite analysis had been completed with employee input to determine potential security threats and hazards and how best to secure the surgery center against workplace violence. Two recommendations I have fall under engineering controls with a set of recommendations under them and work practice controls. Under possible engineering controls is to install a silence alarm system such as panic buttons at nurses' workstations, administrative workstations, and the reception area. Number two, change the keypad lock combinations anytime an employee is terminated, both voluntarily and involuntarily. Have a dedicated employee safe room for emergencies. Install monitoring systems such as closed circuit TVs to observe the reception area, the waiting rooms, the exterior of the building, and the parking lots. Install curved mirrors and place nurses stations and administrative workstations in areas where they can best view the reception and waiting area. Under the work practice control, I did a little bit of research to determine the effectiveness of having security officers. And the National Institute of Health conducted a study that determined that security presence has been reported to reduce the incidence of violent events. And it was also reported that the odds of a nurse being physically assaulted at work were reduced, not eliminated, reduced when there was a security presence. At the same time, an inadequate security, the study determined, has been a contributor to the occurrence of workplace violence. Therefore, the two recommendations that I propose under this particular category is to use properly trained security officers and conduct a worksite security analysis with specific employee input to assess security threats and hazards and how best to secure the surgery center. Have a wonderful day. Bye-bye.